All right. Welcome to all our wonderful folks that are patients of Foley Vision Center and just love to hang out and watch us do these webinars. Once again, or today, I wanted to say tonight. Gosh, it's already been a long day already for us here. It's fall into IPL. It's our typical fall treat that we all love from having all that beautiful sunshine. Of course, we've got still a lot of sunshine in the forecast here, but what's great about IPL are many, many things, but it helps us get rid of a lot of that sun damage some of us may have gotten over the summer and may not have been as good about getting their sunscreen on, like Gabby tells us to do. I try. I really try. I'm pretty good, but I have my moments just like everyone else. So Gabby's going to lead us off here in this, and since she is the pro, and then we'll have some fun things at the end, stay to the end, because that's when you can get fun free treatment. And we'll talk more about that as we go. So Gabby, I'm going to let you take over.
Awesome. Hello. And just to add, you're grounded if you didn't wear your sunscreen this summer. But you guys all know and love IPL is what we're talking about today, which I know I probably go, if anything, too in depth. But like always, chat any questions you have. But so what's really cool about our device is the icon. It is not only like the industry leader when it goes to IPL, but it has the melanin reader technology, which basically tells us how much of that tan that you may have gotten and gives us safe parameters to work with when working with IPL. I really like to kind of highlight this because when we are treating for IPL, treats for red pigmentation and brown pigmentation. So think about if you got really tan over the summer, we may want to wait until that tan goes away, just so that one, it's not seeing that tan as a dark spot for it to be extra aggressive on. But two, then we can treat a bit stronger, get you a better result for treating that rosacea or any of the actual dark spots on your skin. Again, when treating for rosacea, why that's important, not only does it contribute to dry eye when we look at how it affects the glands, how there's that connection between Demodex and rosacea. So it's just a really good thing to kind of get rid of that inflammation of the skin. Plus, then we get the aesthetic benefits as well. More things that IPL does for dry eye is that it helps to rejuvenate glands. So when they have been clogged up for a little bit too long, even if we are doing things to melt those clogged oils, such as radio frequency or heated eye masks at home, sometimes when they're clogged up for too long, they start shrinking and just not producing as much oil as they once did. And really the only way we found to help combat this is with doing IPL treatments to rejuvenate those. Lastly, IPL also helps to paralyze Demodex mites, which is fantastic. I promise it only hurts them a little bit, but we're trying to get rid of them anyways. It also helps if you are prone to styes, not only because Demodex can contribute to those, but also it just helps to kill that bacteria that is being a little stubborn, causing issue. So when we look at rosacea, there are 4 different types. One would be vascular. So when you see those vessels on the tops of the cheeks, nose, sometimes on the chin. We have inflammatory, which I like to describe as kind of like when you have that papular rosacea, where you get some almost like acne looking marks. This is contributed from Demodex mites that not only live on your lashes, but for some people with rosacea, they live in the face, burrow into those yummy oil glands, which is why we always see it kind of in that T-zone area. And they can produce kind of like acne from just burrowing in there. Phimosis, which is not as common, but it's where we have that thickening of the skin. And then ocular, which I always like to say, if you have any of the other 3 types of rosacea, you definitely have ocular. But you also don't necessarily have to have facial rosacea for ocular rosacea to be affecting you as well. Here is a little video of just how IPL works for, you can see this dark spot up here and some of those feeder vessels that are coming up just a little bit too high. And it basically just, the light absorbs into that pigment and vaporizes it for either your lymphatic system to clear out those vascularities, or it breaks up that brown pigmentation and pulls it up to the surface. I like to say it's kind of as if it's coming back out the way it came. I always like to mention as well, because people ask me if, aesthetic lasers are harmful. And you can see that in this middle area, we have what would be aesthetic lasers. On the far left, we have some X-rays, which are obviously not something that we want to be exposing ourselves to. And on the far right, we have like microwaves and things like that. Lasers live in this it's harmful if you were to go in with no eye protection, but they live in that area where it's not causing harm like X-rays would. So I always like to mention that as well. And see, I know you guys already know everything about IPL, so I want to keep it pretty simple for you guys today.
That was great, Gabby.
Awesome.
Yeah, I think you touched on really good points in that IPL is going after pigment and vessels. Reason we've been using it for, this is our going our 6th year, is that it is one of the best treatments for eye surface dry eye. And of course, as most of you all know, that's what we specialize in here at Fully Vision Center. And I've been lecturing on for about 18 years now. Gosh, time goes by really fast. And of course, all of us here at Fully Vision Center get IPL treatments on the regular because we all have some rosacea. And part of that's just because our genetics. And the other part of it is just, sun damage that we've had over the years. I grew up in Southern California. Yes, I can admit that. I've been living here now for 30 years in Oregon, so I feel like I'm a native now. But yes, I spent a lot of those years in the sun before the age of 18. And we know 80% of the damage to the eye happens before the age of 18. What do you know is that about the same for our face too, for our skin, Gabby?
So, as far as pigmentation, that totally depends on lifestyle. I've heard of stories of people, the minute they turn 18, they start heading into tanning beds, and by 20, they have melanoma and dark spots galore. And I'm always lecturing. I have a 15-year-old little sister that tries to go tan on UV 10 days because it's the perfect day to tan. And I tell her, I'm like, well, guess I'm going to age better than you. And you'll be looking like my older sister when we're old and wrinkly. But as far as rosacea and overall, like collagen and things like that, about 20 is when things just start getting slower. So I always like to think of it as if you skid your knee when you were 5, about a few days and it's pretty much healed over. Whereas even if I were to skin my knee now and I'm 25, it's going to take at least a week, at least. And so things definitely slow down, which is why IPL is so great, because it also targets water in the skin, which activates that, let's build some collagen and elastin because of that micro injury.
Excellent. I think that sounds great. Yeah, it's amazing all the benefits of IPL. We're learning almost every day that, this inflammatory skin issue is deeper in the skin. And we're also looking at, what some studies are telling us about, of course, how it reduces your skin cancer risk, but also too about plaque formation in the brain. So we have a lot to still learn about rosacea. We realize it's just deeper than we ever thought. We always thought it was just this superficial thing, but from regards to the eyes, it's the main underlying foundational inflammatory piece, which IPL does a beautiful job. And it requires some touch-ups, right? Everybody's a little bit different. Gabby is great because she can talk on the aesthetic side of touch-ups, and we talk about kind of on the OSD side of the touch-ups. A lot of times they are hand in hand the same, but it does require some maintenance. So your little short, series is going to be something we have to stay on top of down the road. And yeah, so that's, I think, a big piece of it. As far as other things we use with dry eye treating with, a lot of times we have to put folks on a topical prescription eye drop medication, anything from Restasis, Cequa, Xiidra, Mibo. There's Tuvia. We have a lot of choices now in the toolkit, but this is kind of the foundational piece. And if we need to weave in some other things due to other autoimmune conditions going on in the body, then we take advantage of those. The nice thing is most of the time we don't have to do as much. And some people we've been able to take off a lot of their prescription drop medication, which can get expensive over time. So it kind of budgets out kind of the same or even as a huge bonus when we look at this down the road, because surface disease never goes away. It is like your best friend clinging to you for life. And it is a chronic progressive disease state, much like glaucoma is chronic and progressive. So we have to get in and stop it before it goes off the rails. And we have had people where they've had vision loss from this because of all the damage to the front surface of the eye. So we do take this really seriously. Do we have any questions today? Looks like, boy, everyone's recovering from their Labor Day weekend. Yeah,
Exactly.
we are too. Any thoughts, Amy or Stevie, on questions people ask about this that you guys end up fielding a lot that we might not have covered?
I don't think
Wow.
so. I think the most important one, I think Gabby has already touched base on, is the sun. You know, when you have these treatments, you need to stay out of the sun. You can't have any kind of tan and then once you get the treatments done, you need to stay out of the sun for a while.
Right.
Another
That and
thing
also,
I like to touch
uh,
on is topicals as far as IPL goes. As far as rosacea goes, there are two safe exfoliants, which is going to be retinol or tretinoin, which helps with that type 3 rosacea where there's a thickening of the skin. It can also help a little bit with type 2 where we have those papules. But also azelaic acid, which is something that I've been playing around with for the past 6 months and have had a lot of success with for myself, where I'm more prone to that type 2 papular. I am prone to Demodex. They love me, unfortunately. And so I had a lot of success back in, I think it was February or March, where I had started XDemvy for the mites in my eyes, because you cannot do these exfoliants on the eyes. And I started azelaic acid, and that made a huge difference. And so that's been something that for some people that have more that type of rosacea that I've been recommending, that is also IPL safe because it's not photosensitizing. And so I've been telling people, if you want more information, my email is always open, because I have become the past 6 months a true believer of some of those, more common rosacea topicals that they've been great.
I think it's fantastic. And of course, we are so thrilled for having XDemvy now. It's just been a game changer in the practice. When I lecture, I basically tell all the eye doctors to start there first, get rid of all the mites. And it is a fantastic drop used twice a day for about 7+ weeks or so. Does a phenomenal job. And when you get rid of the mites, it does minimize some of the infestation here. Of course, if you have a lot of it, then I think the azelaic acid, we're looking at that too, to add that into our part of our treatment regimen. So we can be prescribing that for patients, because I think that's going to be amazing to have for an ongoing basis. So it really is a two-pronged approach. This is not, as we've learned about ocular surface disease, it's complicated and there's so many factors at play for some people. It's menopause, it's skin, and the skin is your largest organ. And so really understanding this and having Gabby, we're so lucky to have her on practice, because she knows skin inside and out and just does a beautiful job with our patients, and everyone loves seeing her. And cannot afford to not want to come and see Gabby, because it's so much fun to chat with her while she's doing the treatments. She really makes it an enjoyable experience. I can say that to myself. Next month, we'll be talking a little bit about fractional laser and some of the beauties and benefits we can do for dry eye with that too. So do stay tuned next month, the first Tuesday of the month as well. I think we don't have any questions. Wow, you guys are being quiet today. Usually we have zillion questions. Then I think we're ready, Stevie, for you, my dear, with the prizes.
Stevie, take yourself off mute, honey.
Okay, sorry about that. One more thing before we end this, we wanted to extend our school supplies for, is it 2 weeks? Is it 2 weeks?
Yes.
Okay.
Yes.
For 2 more, for until the 13th, Friday the 13th. Yay. Because we wanted to give people another second chance, because some people didn't hear about it. I don't know how. I don't know how, but they didn't. So we're gonna do that one more time. And what we do with the school supplies is the people that bring in school supplies, just donate them, get their name in a list, get their name in a raffle, and then they win a 3, I believe. Am I right? 3 eyes only IPLs. So there we go. So bring in those school supplies. I know some of you have, thank you, but let's keep them going. All right, so with that being said, today we're going to give away a eyes only IPL treatment. So yay, but don't do the retinol or the antibiotics or I'm just kidding.
Stay out of the sun.
Just kidding. Yeah, that's fine.
Drink your
Before you
water.
schedule,
Drink your
check with
water.
us.
Yeah. All right, I'm digging in. I'm digging in. I'm digging in. I'm digging in. And here we go. Sherry. There's only one Sherry S here today, so I think you know who you are. Okay, so give me a call. Yeah.
Yay.
So
Con-
give me
Congrats.
yes, we are very proud of you. Just give me a call and we can get that scheduled for you. All right.
Excellent. I think, oh, and Sherry says yes, and she's waving her hand. So good job, Sherry. Definitely, we want to take advantage of that because it's really great. And it's, again, another reason why you can't see Stevie's gorgeous skin when she's under the kind of darker lighting. We're going to have to get you a ring light. But Stevie is our vampire in the practice. She's very good about staying out of the sun, and you can tell because she's got gorgeous skin. And of course, she sees Gabby on the regular, and she sees Amy too. So we share the love here in the practice. All right. Well, you wonderful people, I hope you have a great rest of your work week. And the end of summer is coming. So
I don't know about that. It's supposed to be 101 on Thursday. 101.
we're in Oregon. What is it? I feel like I'm in Southern California. This cannot be happening. It was so lovely yesterday, I have to admit. It was gorgeous being
Yes.
overcast. I was in my heyday. All right. Love
Stay
everybody.
hydrated, everybody.
Yes. Thank you, everyone. Thanks
See
for
you next
joining
month.
us. All righty.